What's your name?
My name's Agnes Taylor.
Agnes.
Yes.
Okay. And how can I help you, Agnes?
I'm hoping my prescription's ready.
Oh, okay. I see a prescription here. Just want to make sure that everything's appropriate. Do you have a few minutes to talk about things before? Okay.
Yeah.
Did you have anything else you want to cover today?
No, just to pick it up and I'll have to know how to use it too. I don't know.
Okay, so this is a new thing for
It is.
you. Okay.
Yeah.
So I noticed the prescription here. It looks like tinzaparin.
Yes.
Okay. Now, did your doctor tell you anything about that?
Well, I'm going in for knee surgery, and so the orthopedic surgeon said he was going to tell my family doctor to prescribe it for me.
Oh, okay.
As a blood thinner.
All
That's
right.
pretty much all I know.
Okay. Why are they worried about blood thinners for you?
I've got atrial fibrillation,
Oh.
so I've been on warfarin for the last 5 years.
Okay, I do
7
see that.
years, yeah.
Great. So how has that been going? Your atrial fibrillation, is it well controlled? Do you notice?
It seems like it, yeah.
So you don't notice really fast heart rates or anything?
No.
You never had to be treated for that?
Nope, not yet.
How long have you been on the warfarin for?
At least 5 years.
5 years.
Yeah, probably even a bit more.
And everything's been good with that, with your levels and stuff? Have you been
Yeah,
getting that
yeah, I've
checked?
been going in every month, and my dose hasn't changed in the last 3-4 months.
Wonderful. Good job, because that can be hard with diet and everything to manage that.
Yeah.
Wonderful to hear that you're doing well with that. Now, tell me a little bit about your knees. You've been having some issues.
My left knee has bad arthritis.
Left knee.
Yeah, so I'm getting a new one next week.
Oh, well, congratulations.
Yes.
Pretty
looking
excited.
forward to it, yes.
Have you found that you've been having a lot of troubles the last little while?
Well, it's gotten worse over time,
Mm-hmm.
and it's only going to get worse, so we
Right.
figured why not just fix it rather
Might as
than
well.
dealing with the pain.
Yeah. How do you deal with pain right now?
Just Tylenol.
Tylenol.
Yeah.
Okay. Is that regular strength?
I use extra strength, and I only take it when it really bugs me, so maybe like twice a day.
Twice a
Once
day?
Twice a day, not very much.
Okay. It's just sitting here right now. How would you rate your pain on a scale of 1 to 10?
Just sitting, probably like a 6 or 7.
6 or
Yeah.
7.
If I sit too much or if I move too much, it's a lot worse.
Yeah, I imagine. Okay. And does it shoot anywhere, or can you describe the pain to me?
No, just a throbbing. Just feels like if you hit your elbow against something, it has that ache.
Mm-hmm. And you said with movement it makes it much worse.
Yeah.
Okay.
Yeah.
Have you tried anything else other than Tylenol to make it better?
Like hot packs, and just walking, and loosening it up a little bit in the morning, especially. It's quite stiff. So.
Okay. That's understandable. Well, I'm glad you're getting the surgery then. It sounds like that's a really big move forward in this stage in your life.
Mm-hmm.
All right, just a few other questions about your medical history. No other medical problems other than, I see macular degeneration as well.
Yes.
How long have you been battling with that?
Probably about 10 years.
10 years?
Yeah.
How would you rate your vision right now?
Well, my optometrist says it's stable, which is good. I take an Ocuvite to help keep it that way. That's what he recommended, and I don't know. I can see quite well. It's just anything that's really small, I can't read.
Oh, okay.
So like the little information sheets on the inside of like a cough
Right. That'd be
cough
hard.
cold box, I can't read any of those. That's too small.
I noticed we have print large labels
Yes.
for you, so that's good. Okay, we'll try to do that. What about other history, social histories? Do you smoke or anything?
I don't smoke. No.
Good. I was
Never
worried
have.
about with Ocuvite. There's some concerns with that possibly, so that's great that you don't smoke.
Yeah.
Do you find you're getting a good nutrition and exercise?
I think so, as much as I can.
Wonderful.
Yeah.
It says here you have no allergies.
Nope.
Okay, nothing new.
Nope.
All right. And you've just been taking that warfarin and the tinzaparin's new and Ocuvite and Tylenol. Nothing else for herbals or over the counter?
No, that's it.
Great. Well, I want to tell you that I'm a little worried about this medication for you, safety-wise.
Okay.
The reason being is you have to draw it up yourself. And I'm worrying with your eyesight that you might not be able to see the appropriate amounts to actually draw it up.
Oh, on the needle.
Yeah.
Oh, yeah.
So that could be a real safety issue if you're giving yourself too much or too little, right?
Yeah.
And you want to make sure that you don't build up clots. So I'd like to talk to your doctor and just possibly recommend something else that comes in a pre-filled syringe that we could use. Now there's a couple options. It's a little cheaper to go with one that you have to poke 2 times a day.
Okay.
Or you can poke yourself 1 time a day and it's about $10 more. Do you have any?
I'm retired, so twice a day isn't a problem.
Twice a day is not a problem?
No, not at all.
Okay. Okay, so that'll be a little cheaper for you. And I'll talk to your doctor about that.
Okay. And so when you say pre-filled, that means like the dose is all full and I don't have to worry about how much I give.
Exactly. You just give it to yourself and it's an exact amount.
That'd be a lot better.
Okay. I'll talk to your doctor then if you don't mind.
Okay, sure.
Do you want us to stop the time?
Yeah. Oh, we have to use
Oh.
one of these phones are linked up there. And I have to follow you. It's kind of awkward.
Stop doing
No, I know, you can't do that. This is amazing. And then I was waiting for him to make an empathetic response, and he hadn't, and then he did, so this doesn't even count.
I
I feel like just writing little notes.
like everything, cause he was kind of going everywhere, but then he was like,
No, but that's the thing, that's like...
let's start it again.
Exactly. She was quite really she would like something that's great. So I will switch it to great sound. All right. So I just talked to your doctor,
Okay.
and he agreed to switch to this medication. We chose the one that's a little cheaper,
Yeah.
but you will have to poke 2 times a day.
That's okay.
So I'd like to tell you a little bit about that medication right now, okay?
Yeah.
So you're on warfarin,
Mhm.
and it's important we need to stop that warfarin 5 days before you actually go in for surgery.
Okay.
So on that 5 days before, we're going to start the enoxaparin shots on that day.
Okay.
You need to not take anything the day of the surgery,
Okay.
because these medications can increase your risk of bleeding. So we don't want to, obviously, if we're doing surgery, we don't want to increase your risk of bleeding. Okay? After we're done, they'll probably set you up about 24 hours. You'll start taking both medications again.
Okay.
Okay? And have you ever given yourself a needle before? Okay. So the biggest thing with that is they come in pre-filled syringe. They got the needle right on them.
Okay.
So what you're going to do is you're going to take an alcohol swab, clean the area, and where you can inject this is usually in your belly or inner thighs.
Okay.
We need a little bit of fatty tissue to inject it into,
Okay.
okay? So pinch an inch, okay? And take the needle, inject it at a 90-degree angle, directly in, and then to plunge the vial.
Okay.
Okay? Don't massage or anything. Just take it out, and you're going to want to rotate sites.
Okay.
This medication will cause bruising.
Okay.
Okay? So just rotate site. You may notice some bruising all over, but that's an unfortunate thing with the medication.
Yeah.
Okay?
Okay.
Like I said, this medication can increase risk of bleeding. So obviously, if you get any kind of blood in your stool or darkness in your stool, you want to get that checked out.
Okay.
Also, if you're noticing you're brushing your teeth and it's bleeding into your nose bleeds, you let us know right away.
Okay.
And we'll want to get you back and monitor your INR levels. That's what we were monitoring before with your warfarin. And get you back to a therapeutic range when you get back. So I'd like you to come in and see me as soon as you get out of the hospital.
Okay.
Okay? And another weird thing with this medication that we give in sometimes, it's pretty rare, but there is a syndrome that we want to watch out for. So if you ever get fevers, chills, muscle aches or something, let someone know right away just so we can make sure. Okay? What questions do you have for me?
I think that's about it.
Okay. Just to make sure that I've explained everything appropriately on dosing, which is very important, can you tell me how you would take the medication?
So I'm going in for surgery in a week, so that means in 2 days I would stop using the warfarin. and start using the injection. And the injection's twice a day, so 12 hours apart in the stomach, usually changing it every time, not in the same spot. And then not the day of the surgery, and then they'll advise after.
Wonderful.
After that.
Yes, good. And they'll take care of you. But like I said, I want to follow up with you afterwards just so that we can make sure that your levels are all good and your medications are all working good for you.
Okay. And I keep injecting until you guys tell me to stop.
Basically,
Okay.
yes. Yeah. It could vary. It depends on how well you're getting around because we're really worried about blood clots, right? Did they explain that to you?
Yeah.
So it depends on how you're doing that way just to prevent those. Okay? Sounds like you're doing really good with your diet and stuff, so just keep going with that. If you have any other questions, don't hesitate to call.
Okay.
It's really nice talking to you today.
Thank you.